pre-hospital setting, use of the clinical decision-making model is a good way of using your clinical skills to work out and problem solve the case. So using the acronym Dent, you define the problem, explore your options, narrow down, and then treat the patient. So in this case, we're given a 48-year-old male with a heart rate of 75, BP of 130 on 70, respiratory rate of 24 with chest discomfort. He described this discomfort as a lump behind his sternum and was not involved in any injuries to his chest. Sensation hadn't changed when he was sitting down, standing up, or moving about. And he said that he had indigestion for the past 3 weeks. He's not currently taking any medications and has no previous medical history. So the first stage is defining the problem. The patient has presented with chest discomfort, and therefore that's what we're going to investigate. So with chest discomfort, you need to explore the possible causes of this. We started with the description, which is a dull pressure and not a pain, which is generally considered cardiac because there's no pain receptors. The location of the chest was generalised and not localised, also another good indication of it not being pleuritic or traumatic. His skin was cool, pale and clammy, and this should have been, this is an indication of possible sympathetic effect, and this discomfort continues at rest and moving about, it doesn't really change. So the third stage is narrowing down the problem. We can cross out a possible infection with the temperature from the patient. He didn't, so therefore it gets off the list. He was not involved in any trauma that we're aware of, but there was also no bruising and there wasn't any pain or palpitation. Therefore, this can also be narrowed out. The patient complained of indigestion, but he had not eaten this morning, so therefore it also gets narrowed out. Possible pleuritic, when we asked the patient to cough, he had no pain and there was no phlegm, so therefore this was also knocked out. The possibility of angina was ruled out as the pain or discomfort was continuous at rest, which left us with possible infarct, in where an ECG revealed ST elevation in leads 2, 3 and AVF. So from all these causes up here, which generally indicated cardiac, was confirmed by narrowing down the options. So treatment of the inferior infarct, you need to go through your indications and contraindications, both GTN and aspirin. The GTN was not able to be given as his BP was below 160 and he had a right ventricular infarct from the ST elevations. So the best treatment for this patient was to transport him to a cath lab, which was possible due to having a 12-lead ECG, which is the prerequisite to get in. Overall, it was found that a blockage of the right coronary artery was this patient's issue.